So just been called to a scene. We've got a 25-year-old woman who's just fallen out of a tree. You happy to help out with everything?
Yeah.
Sweet. Okay, so just entering the scene. You can see that there's a tree. It's like stable. It's a nice sunny day. It's clear to enter. Hello, madam. Can you hear me?
Hi, yeah.
Yeah? Okay, so immediately I can see that there's bleeding on the arm. So you don't mind if I just deal to your wound there, please?
No, it's okay.
Okay, alright, so I can see that there's a cut there, so I need a couple of things. So, great bandage, some saline, and also the bandage to wrap it up. So before I do that, I'm going to expose the wound. Just hold still for me, thank you. And I'm going to apply my saline, just make sure it's nice and moist and wet, and then apply this bandage on. Wet that so it doesn't stick, and put pressure on it as I wrap it up. What's your name there?
Sarah.
Sarah. Okay, Sarah, do you have any other injuries?
Yeah, my neck's a little sore.
Your neck's sore?
Yeah, and my ankle's quite sore as
Okay. Lucy, can you stabilize your neck, please? As I'm putting on the bandage, I'm making sure that I'm getting some twists to make sure that I get a lot more pressure and that it's wrapped around the whole 15 centimeters of the wound. And as I can tell, Sarah's eyes are open, she's communicating, so immediately she's got quite a high GCS, which is, that is a good sign. Okay, now I've got my bleeding under control. I'm just going to leave that there, or I'm going to elevate it. So I know that you've got a neck injury, but what I'm going to do is just sweep through your body so that I can see if there's any other injuries. Is that okay with you?
Yeah.
Okay, if you can step away from the bed, please. Okay, so you've got a sore neck, so just start at the head. Just say yes or no if something hurts. Try to refrain from nodding. Is that okay?
That's okay.
Okay, how's this?
That's a bit sore.
Okay, what about there?
Yeah.
Okay, which is more sore, that midline or the side?
Towards the middle.
Middle, okay, midline pain, so it's the first not good sign. Are your shoulders?
That's okay.
Yes? Okay, so sweeping your arm. How does that feel?
Yeah, that's good.
No blood, that's good. I know that there's a cut there. Just going to check upper arm's good?
Yeah.
Okay, alright. I'm just going to search down your chest. Is that okay?
Yeah.
And up here, is that fine?
Yeah.
Okay. Just come to the side. Put this on. Back up. Okay, can you breathe in and out for me? Okay, can you breathe in and out for me? Okay, is that sore at all?
No, it's okay.
Just checking your back. Okay, no blood. Just gonna feel for any flailing of the chest. Does that hurt at all?
No.
No, okay. Just gonna check your pelvis. Hurts?
No, that's okay.
Alright, just checking your leg. Everything's okay?
Yeah.
Everything's good. Okay, checking the other leg.
Oh, it's getting a bit sore.
Okay, can you tell me where? Ankle?
Yeah, ankle's quite sore.
Because I can tell it's quite abnormally shaped. That's another not good sign. So what I've got so far is a possible C-spine fracture and also an ankle fracture. So to prioritise, I'm going to deal with the neck first. Can you see what I did, please? By doing that, I'm going to get a C-spine collar. Sarah, have you had anything to drink today?
No.
Okay, so under the Nexus rule, because she hasn't been drinking, but because she does have midline pain or distracting injury, she warrants for a C-spine collar. So I'm going to measure it on the shoulder to her neck and size it up accordingly. And then apply this on. So I can see that she's got some earrings, so I just need to be careful about that. Right, ready? Slide this under the head. And just going to wrap this around you. Just careful of the earrings. Okay, just look up like you're going to sniff. Like you're trying to sniff some flowers that are on my face. Okay, well done. Okay, good. So it's under control. Just to help with airways, I'm also going to get a towel and put it underneath her neck. Okay, how's it feeling for you now?
Better.
Better? Okay. Now, that's under control. I need to get to the ankle, but first I see bleeding coming out of the arm already. So I'm going to wrap this up. So again, applying pressure, lots more pressure, and doing my twirls. So now I'm going to move on to my ankle, but before that, I'm just going to deal with some pain management. So, can you describe your pain out of 10 for me?
Probably like an 8.
8, okay, that's pretty high. So before I head on to the ankle, just to give her some relief, I'm going to give her some methoxyflurane. Okay, have you seen this before?
No.
Okay, this is methoxyflurane. Have you heard this in any of your family history of allergies or?
No.
No? Do you have any kidney impairment or failures?
No.
No? Have you had malignant hypothermia?
No.
Okay, and do you know if you have any allergies to this methoxyflurane?
None that I know of.
Okay, so from that, she's cleared to for me to administer methoxyflurane to her. So I'm just going to do a drug check. So methoxyflurane, so 3 ml dose, expires 2021. Going to check for my offhander.
Yeah, so it's methoxyflurane and expires in 2021.
Okay, so it's clear. I'm going to administer it. Get the ampule, which is 3 ml, put it into here, and it's good to go. Because she's an adult, she can have up to 6 ml. And this is a self-administered drug, so I need to coach her. Okay, alright, so can I get you a good hand?
Yeah.
Alright, so you want to be sucking into the whistle and blowing out of the same whistle as for pain relief. You can get a little bit dizzy or nauseous from it, so just let me know. And if I don't see you blowing out of the same whistle, then I have to take it off you. Is that clear?
Yeah.
Awesome. Alright, can I see you use it? Well done. Okay. Now it's safe for me to move on to the leg. However, I can see that the bleeding is still coming out. I'm going to have to resort to a tourniquet. So by this, I need to make sure that the tourniquet is 10 centimeters above the actual cut and on a single limbed bone. So I've got the humerus up here. So what I'm going to do is tighten it up. And twist it until I can no longer feel a pulse. As soon as I cannot feel the pulse, then I'm going to lock the tourniquet in place it on, and write the time as we put it on, as we cannot take it off until we get to the hospital. So I'm just going to expose the wound now. Say if the wound was still bleeding, I'll probably need to give her another tourniquet and call for backup, because we'll need to administer some stronger pain relief that we are unable to give her. So now I can see that the wound is nice and clear. It is not bleeding, so that is okay. It is safe. These will be disposed of. Okay, so pain relief, collar, that. So it's time to move on to the leg. So for fracture management, I need to expose both limbs. So I'll expose the good limb first. It's okay. It's okay that your laces are double knotted. Just go and take off your shoes so that I can see both limbs. That's okay?
Yeah.
Alright. So I'll also, these legs are quite tight. If I had scissors, I would cut these, but because of this demonstration, I won't do that. Lucy, can you come down here for a sec? I just need you to stabilize the joint and the limbs as I take off your shoes. Is that okay with you?
Yeah.
Sarah, can you hear me?
Yeah.
Alright, this is just going to be a little bit painful, so I'll advise you to take some puffs of that methoxyflurane now.
Okay.
Okay, ready? 3, 2, 1. Nice. Okay, just going to take off your sock as well. Can you hold the limbs still? Ready? Just a couple puffs. 3, 2, 1. There we go. Thank you. Back to the head.
Yeah.
Okay, so just going to do some baselines. So first I'm going to get pedal pulse. Okay, I can feel that it's stronger in her left than her right. Just going to get a capillary refill. Ready? 1, 2, 3. It's okay. 1, 2, 3, 4. A little bit slower. Can you feel this?
Yes.
Yes. Can you feel this?
Yes.
Can you wiggle these toes for me? Excellent. Can you wiggle these toes for me? Okay, slight impairment, so, and I can see that it's abnormally coloured, shaped, so I'm going to warrant that as fractured. So to deal with that, I'm going to brace it in place. So can you come down here, Lucy? So I'm going to measure my splint from the side of the fracture to the most mobile joint. So luckily this limb, luckily the splint is in the right size. I need 2 triangular bandages and a whole lot of tape. So I need you to hold this in place for me, please. So it's okay to be liberal with the tape because we don't want this falling apart. Okay, because we're using our towel for her airway, I can see that she's got a jumper already by the tree. Is it okay if we can use this tree to support your foot, Sarah?
Yeah, you can use my jumper.
Perfect. So this is just to make the splint just a little bit more comfortable for her and just stabilize it a little bit more. Okay, so on my mat, Lucy, we're just going to, I want you to lift up her leg so that I can get the splint in place.
Yeah.
And just straighten it up. So Sarah, take a few puffs of the methoxyfluorine. This is going to hurt a little bit. Ready? 3, 2, 1. And down. Perfect. Alright, you can get back up to the head. So I want to tie this up to make sure it's nice and secure. And so I'm not tying it around the limb or the point of fracture. Okay, there we go. Now that we have everything under control, limb, neck, and bleeding, so I'm just going to do my distal baselines again. So I'm going to check for pedal pulse. And on the left side is strong, right side is a little bit weak, it's okay. Ready? 1, 2, and ready? 1, 2, 3. A little bit slow. Can you feel this?
Yes.
Okay, can you feel this?
Yeah.
Can you wiggle these toes for me? Well done. Wiggle these toes for me. Okay, so motor skill's still there, so that's okay. Now, by this time, we are thinking of exiting, getting her to hospital. So for that, we need to get some baselines sorted out. So before this, I'll also be thinking of taking another form of pain relief, which is liquid paracetamol. The reason why liquid is because she's in a neck brace and taking things like pills will just be a bit too hard for her. So what's your weight, Sarah?
70.
Okay, because she's 70 kgs, she warrants to have at least 20 mils of liquid paracetamol. And as I'll do with the methoxyfluorine, I'll check the expiry date, check with my offhand, then administer within a syringe, so it is nice and easier for her to take. And I'll also check if she has any allergies towards it too. So first up, I'm just going to get her blood pressure and heart rate. It's always good to check your equipment to make sure that you've got a good one. Right now we've got a spare, which is fantastic for this. So we're going to touch blood pressure cuff over, make sure I can see my dial, and my stethoscope where I need it to be, and pump until I can no longer feel a pulse. Okay, I'm going to slowly lower it so I can feel the systolic pressure. As soon as I can't hear it, it's a diastolic pressure. Okay, so she's got a blood pressure of 180, which is okay. That's still within normal range because systolic is, the ranges of systolic is between 100 and 140 for normal. Diastolic is 60 to 90. You got heart rate, which is for 60 to 100. Capillary refill should be around 2, and respiratory rate should be 12 to 20. So I'll be checking all that right now. So just going to check her heart rate. So I'm going to do that by palpating her radial artery and just holding it across her chest while timing for 15 seconds and timing it by 4. Okay, so timing that by 4, she's got a resting heart rate of about 80. A little bit on the high side of heart rate, but still in normal ranges. I was also testing her breathing, so her breathing was at around 12, which is okay, a little bit low, but still normal. Just going to do a capillary refill. 3, 1, 2, yep, capillary refill's good. Cool, so just going to check her lungs. So by doing that, to get the best results, I'm going to need to lift up her top. So Sarah, do I have permission to lift up your top so then I can get your, just see how your lungs are?
Yeah, that's okay.
Okay, just because it's a demonstration, I won't do that. So ready, can test it, breathe in, and out, in, and out, in, and out. Breathe in and out. Breathe in and out. Breathe in and out. Okay. So she's sounding fine, so that's okay. What I'm going to do is go to the truck, get a stretcher, put her on it, and we'll take her to hospital.